warm welcome. You are watching the Fox Times evening show Unleashing India Web Summit series post COVID 19 Devastation, enhanced role of medical professionals and healthcare for national growth. This Unleashing India Web Summit series brings to you the real gem of experts from the different sectors of India to talk on the contribution of that sector and of that sector professionals to national growth. Because the end objective of this discussion is how to achieve national growth and nation building. And when we do that, a nation cannot be built by just one professional or one sector. It has to be done collectively with all stakeholders together. And this session is led by and chaired by Dr. P. Shekhar, who is a chairman at Global Smart Cities Panel. Dr. Shekhar has written over 80 books on different topics of blue economy and e-governance and issues. He is also an architect of the doctrine called secure governance. So he looks from the eyes of secure governance to nation building and national growth. Today, I would not take much of time of the discussion as we said that our medical and healthcare professionals are saving hundreds and thousands of lives every day. And they have been the pillar of this country since the beginning. And I don't know how much respect they often get, but they also often get a lot of insults and a lot of bashing by media and different professions. We have heard on a lot of incidences how doctors and health professionals are being attacked by some victims' family and family members. But nonetheless, we should understand that this might be one in million or hundreds or thousands of cases, but in millions or thousands of time, except that minus one, they have been saving hundreds and thousands of lives. During this COVID 19 crisis, when our politicians, when our bureaucrats, most of the people, and the common people are sitting in the home, keeping themselves secure, a hell lot of our state, this health professionals are on the streets, are also treating these people with their taking all the risk possible and risking their own life and family. So we will, from the eyes of the nation, talk about what more constructive role can we have of our health professionals on nation building. Dr. P. Shekhar, without taking any due, may I request you to kindly take over the session? Yeah, sir, please.
We have had a series of Unleashing India Web Summit. This particular summit on healthcare, medical professionals, it is going to be a very different cup of tea. Now, when we talk of medical professionals, there is one basic thing which we as Indians should know. When Britishers left us from India 70 years back, they left us as a country with an average age of 24. In 70 years, our now present average is an unbelievable 70 years. We have extended ourselves almost 300%. I don't think any field has given that type of a raise. Okay, a proof of pudding is in eating. Here, proof of pudding is how long are we living and whom should we give that particular credit to. This credit definitely goes to the medical professionals. Medical professionals may have their own problems, but they have always been at the helm of affairs as far as India's health is concerned. So, no country, since we know all the countries, has grown 300% in 70 years on any account. Okay. Yes, Indians were living very high. In fact, if you see the old history of India, we talk of Indians living even more than 100 years and 200 years and all. How much of that above 100 years, we do not know in today's medical condition. But they were all living long. When we were subjugated for almost 200 years to 800 years, yes, our health were taken away from us. And we should be very, very grateful to health professionals that that health has come back. See, today, no more a person, even at 70, we call them an old man. Okay. In our young age, even if somebody above 40 to 50 means, oh, he will not have teeth, he will not have hairs, He will not have many things. This will be wrinkled, and we would all, oh, he's an old man. Today, if you tell even a 60-year to 70-year man, old man, he is going to beat you. So, and all these things are not because of him, because of the medical professionals. But medical professionals has got their own challenges. Medical professionals have got their own few things. I'll take few more minutes before I hand over to our experts. I know I have better experts to talk to, but there are few facts and figures I thought I should tell so that we are in the right orientation. Because many times our own systems are such that we want to duplicate what is West. Now in India, medical professional does not mean only the doctor. Doctor becomes a leading person in the medical field. Our every grandmother is a senior doctor. Many times I find what a doctor cannot do, a old lady comes and says, please do to text Y. That's something she says, and the health has come back to normal. And this is for throughout India. Again, in few select countries, but not in all countries. Okay. So they are all subscribing. So let us not duplicate the ratio of doctors to this thing. And many of those particular parameters we have to see from Indian angle. Indians have got their own way of life. Indians have got their own this thing. Something where we were away because of subjugation, that is coming. And even talks of numbers, we have more than 1.2 million doctors, allopathy, and we have got another 800,000 non-allopathy, Ayurvedic, homeopathy, and so on and so forth. We should give due respect to due this. Our professional instinct should not make us not take care of them, and we have to give due weightage to them. Of course, a fly-by-night people should never. They should be taken out of the system. And even talking of nurses and healthcare people, they are also about 3 million. And India is famous for giving nurses, especially from Kerala, throughout the world. Okay. That's another thing which, because they are all, half doctors, because they know much of whatever is being done. And if without them, a doctor will find it difficult to treat a patient. So they are there. And we do have a decent number of hospitals, a decent number of beds, a decent number of things, which has to go up. But because of that, we should not feel that nothing is going to happen. Okay. So that is what is my small take today. What I will do, I will first request our Dr. Rajkumar. Now, Rajkumar is a very strange doctor. The number of degrees he has got goes into I don't know how many lines of this thing at various countries, and he was one of the first in the world to do invasive surgery. So many things which are new he has got, and with all this thing, this man could have earned whatever he wants by just by giving by hours, but he has taken upon himself a different dimension. He is already running many hospitals in 5-6 countries. Okay. And the dream he has got, which he has already put into operation, either within the next 5 years, he is going to build another 55 super specialty hospitals. Bulk of it, of course, will be in Africa and many in India. But in Africa and India, he will correct me if I'm wrong. And this something is a fantastic idea. As you know, even in India, there are 7 lakh people who come to India for medical tourism, which means we also earn a lot of money and they also give less than what they would already otherwise given, and they are all treated well. So he is trying to create a space for all of them in various parts of the countries, in various countries itself, and various parts of various countries, and plus in India. And he has done immense work for this COVID treatment. And he and his wife both are super specialists, and they give their life for people. And whenever even money is given, they return it back. A doctor returning back the money is slightly unheard of, and they do it. Okay. Now I'll hand over to Dr. Rajkumar. Please take over and have your say on. What I would like is I have kind of three different directional questions. It's not question and answer, please. It is how would COVID affect our sector in its present form? What are things to be done to be effective for national growth? And third is, how would this sector, that it means our sector of medical and this, reinvent itself in the present circumstances? And you are all free to say the way you want to say, but we would like to keep it that our session gets over by 6 o'clock. Thank you, Dr. Raj.
Thank you, Dr. Shekhar. I'd like to start by telling everyone that I'll probably speak for 5 to 8 minutes only, because there are other speakers. And as and when Dr. Shekhar or Mr. Akram or anybody else puts in questions, I would love to interact and then add on whatever little bit I can. My father used to always quote George Bernard Shaw. He said, "A good speech should be like the well worn skirt of a woman. It should be long enough to cover the subject, but at the same time, short enough to be interesting." So I hope I can keep my speech that way. I would also like to thank Dr. Shekhar. He's a man with immense potential and somebody, after a long time, I'm coming across somebody who's so focused on developing the country. We need people like this at the planning commission levels, etc. For the youngsters who are watching, I'll now start talking into the subject, but it's important to identify people at various platforms who can help to plan and have a 360-degree view about society and about the country. And I'm very honored to meet somebody like Dr. Shekhar who has that kind of 360-degree vision. Okay, so youngsters try to get this 360 degree. Now, I'll start by answering the first of the three questions. What impact is COVID going to have on India? I will start by saying that although the regular flu probably kills a couple of 100,000 people in India, and although COVID has killed close to 10,000, this side or that side of 10,000 people in India, nobody fears the regular flu. If you tell somebody, I've got flu, they say, okay, stay at home, come back in 2 days' time. You tell them I have COVID, they jump up as if you said I've got a mixture of AIDS and TB. It's sometimes it's a question of perception. And I can tell you that if you look at India, March 21st, 24th, the lockdown started. And now we are 3 months into lockdown. March, April, May, June, just about 4 or 5 days short of 3 months. Probably a regular flu, tuberculosis, cancer, HIV, all these diseases have probably killed far more together and perhaps individually than COVID. Now, I'm not detracting or taking away the importance of the flu, because the big worry is that if you look at the last huge pandemic in 1918 to 1920, it killed 50 million people on earth, and of which in India, which you're concerned about, it killed 18 million people. Predominantly, it killed in Maharashtra, Gujarat, around Delhi and Haryana, and Bihar. These are the population demographics that got killed by the 1918 to 1920 flu. The worry is that if left unhampered, if left uncontrolled, this COVID could kill that many people. And that's why that is the big worry. And of course, on a worldwide basis, it's going to be in a few days, it would have finished off 500,000 people, 5 lakh deaths. Now let's move to how are patients going to think hereafter because of COVID? There is something called the new normal. And the new normal hereafter, in terms of patient doctor relationship, is going to be governed by the worry that there could be a contraction of COVID by somebody walking into a doctor's office. Because a sick man is going to walk into a doctor's office and he's going to get it. So if you look at the current population of the two things I'd like to talk about are the the doctor to population ratio. India's average is something like one doctor for 4,000 to 7,000 people in the country, which is a tremendously high ratio if you compare it to the United Arab Emirates or to Saudi Arabia or, of course, to the developed countries. So in the future, people walking into hospitals, I have a fever, I would like to be diagnosed without necessarily going to a hospital where I could touch something that somebody else touched. In other words, the era of telemedicine has finally arrived. India has been one of the leaders in telemedicine, helping with telediagnostics, helping across diagnostic radiology. One of the largest groups in the world started off in Bangalore, known as Teleradiology Incorporated, in which by getting electronic healthcare with teleradiology, they were able to have such a huge impact upon the market. Followed by Bangalore's example, a number of people from Delhi, Kolkata, and Hyderabad have also followed worldwide telediagnostics. In the future, the tele-diagnostics is going to be even intra-city. Now, many friends of mine, radiologists, are sitting in Bangalore and Hyderabad and in Chennai and reporting on CTs and MRIs from the US. But I'm saying post-COVID in India, people will be looking at patients on the phone or on their laptops or on their iPads, and they will come to conclusions and ask the patients to get investigations done. And after the investigations, they will review them with the investigations again through telemedicine. And there is going to be a huge jump in telemedicine protocols in India. So that's going to be the first major impact of COVID on India, a huge growth of telemedicine and telediagnostics. Second, the second major impact will be that patients are going to be more conscious of their health. It is sad, as Dr. Shekhar always says, with this COVID, it's so much of fear perception. But in a way, it's good. It's brought out the importance, the same doctors. For example, I have personally done close to 2,000 major surgeries on HIV positive patients between 1993 and now. Okay. Many people just thought I was a crackpot and they left me alone. But when I look after COVID patients, where I mean, as long as my immunity is good, as long as I wear the visor, etc., I should be all right. But for the last few months, 3 months looking after COVID patients, everybody treats me like a hero. Whereas I've actually operated on HIV positive patients. HIV between 1985 and today as we stand, has been killing off 3,000 people every day. Whereas, there's no way COVID has killed that. Smallpox has killed 300 million so far. HIV has killed 35 to 40 million so far. But COVID, though it's killed less than half a million, there's this fear. It has brought out all the work of the doctors to the forefront. And because of this, doctors are being looked at in a much better way. And healthcare in India, which is always, I don't know why, the last 10, 20 years, people always think that physicians are going to do loot. Whereas I work out of 11 countries, and I can tell you that nowhere else are doctors so committed as in India. Nowhere else do doctors get telephones, telephone calls and WhatsApps in the middle of the night like India. Nowhere else are consultation fees so low as in India. Nowhere else are surgical fees so low in India. Now, these four things, if you add up, good, committed, intelligent physicians who focus. If you look at the American physicians of Indian origin, it's one of the most powerful groups because we have the brains for that. Now, you add all those four, and I will move to the next question that I was asked. When you have all these low costs, very good doctors, committed workforce, ventilators, at one stage, MRIs, you won't believe there were more MRIs. Yes, I would like this slide, is very good. um, there were more MRIs in Chennai alone than the whole of the UK at one point of time. We're comparing notes. The whole of the UK, the guys who ruled us for 200 years, there were only 13 MRIs. And at that stage in Chennai, we had 13 MRIs. So, because Chennai is, really mushroomed as a hub as a mecca for healthcare, so has Delhi and so has Mumbai and now Hyderabad. So, what I'm saying is, now look at India. Where do I see India going with COVID? All over the world, there's not enough money. Money is the engine driver. Let us take a simple example. I was up in Western Africa in a little country known as Togo. The name of the place is Togo country, and the capital is Lomé. They are French speaking, what they call francophones. If they have any problem, even for a simple test, they go all the way to Paris. If they want to do a bypass in Paris, it works out to something like $80,000. That's literally 56 to 60 lakhs. I told them, why don't you send them to India? They said, because people don't in India don't speak French. So, I had a big meeting with all the people and said, look, send them to India. It will cost you 3 to 5 lakhs. And if you're lucky, maybe even less than 3 lakhs. Okay, you add on some padding, 4 lakhs, 5 lakhs, not 60 lakhs. So this is why they should come to India, because there is a much lesser waiting time in India instead of those poor people flying from Africa all the way. It's not only Africa, everywhere. There's not enough money in the market to justify a 60 lakh CABG. You can justify a 3 to 5 lakh CABG. You don't, in many places in the UK, I worked for 5 years in the UK, even for a hernia, the average wait time in many of the districts in the United Kingdom for a simple hernia operation is 6 months. Varicose veins, 1 year. Now imagine if people all start coming over to India, the whole country, the UK, will save money instead of spending huge amounts there. And that money can come back to India. Recently, I was watching a video by Shashi Tharoor in which he said there's something like 200 million pounds is owed by the UK to us for what they looted us. They can start paying back the 200 million pounds by sending their patients for healthcare for the 2 years in which they brought down our GDP, 2 centuries in which they brought down our GDP from the first in the world to among the last 20 in the world. They can then send their patients over. And what I'm talking about, I've been so many places. You look at Macedonia, Estonia, Latvia, all over the world. It's the same story. India is actually occupying a very privileged position as having such good doctors, whom I'm sure my IMA friend will agree with me, whose value until recently has not been fully recognized by the people who are willing to operate on people who are coming from outside, and that will cause a huge increase. The third point, so undoubtedly telemedicine, undoubtedly tourism, and the third thing is, as shown beautifully in this slide, insurance for some unknown. And I've quoted this on television in South India in the vernacular channels. Classic example I've seen so many times. Do you have another couple of minutes, Dr. Shekhar?
Yeah, please, please.
Another 2 3 minutes, because I can see there are other people waiting as well. A person coming in a motorbike has an accident, and this grisly, nightmarish spectacle has been seen by me at least 10 times in the last 20 years. Somebody comes in a motorbike, has an accident, has a major head injury. The motorbike is 100% insured because you can't ride a motorcycle unless it's fully insured. But the head is not insured for the head injury. Some poor doctor in some small nursing home is desperately treating him. And then suddenly a huge crowd gathers around saying, "You're holding lives to ransom for a head injury neurosurgeon, you're asking 4 or 5 lakhs." The bike or the car, if it costs 4 or 5 lakhs, the insurance company will absorb it. How could it be the fault of the doctor trying to save the life of a patient who has not insured his head, but he's insured the motorcycle? And this is such a sad state of affairs. If Indians, now with COVID, everybody is worried. Oh my God, I may get fever any day. I may have to go to the hospital any day. And this is acting as an engine driver of sensible behavior. If you look at the evolutionary perspective, the gene, the chromosome, or the human being, any being will try to do whatever it can to increase its survival and its life expectancy. And the first thing Indians must do, and which I believe that they will do immediately after COVID, is they will, more of them will get insured, which will increase the bridge between patients and doctors. If there are more insured patients, there are more doctors willing to treat them without any problem at all. So, in conclusion, a huge growth of the healthcare industry through massively through travel and through medical tourism. India has got so many wonderful places that you can see and enjoy. We just don't respect our own heritage. If you go to England, anything that's 100 years, 200 years old, there'll be one big monument, and there'll be thousands of people willing to pay 10, 20 pounds, which is 2,000 rupees to see it. You go to the US, 50 years old, heritage monument. You go to India, I remember seeing the Tipu Sultan's, the place where he was killed in the Battle of Seringapatam. One small slab, and a few children were using that to play cricket. We need to wake up. We need to have a sense of our history, a civic sense, combine it with a sense of good doctors, have wonderful medical tourism. I think we can bring in huge amounts, billions of dollars into the country. So healthcare industry through medical tourism, increased telediagnostics, telemedicine, and increased insurance. These are going to be the three major linchpins of changes in the healthcare industry as I see it. Thank you very much, Dr. Shekhar and Mr. Akram, for having given me this opportunity. I would love to hear the other experts speak as well. And then, of course, as and when questions come in, I will be too pleased to take them. Thank you again very, very much.
Thank you, Dr. Rajkumar. I have our friend Dr. Avinash Bhondwe. He is a pioneer in the medical field. He is also an activist of positive nature. General word activist means one is afraid. He does only good things in his activity. He ensures that people are taken care well, doctors are taken care well, and anything to do with medical means he's there day and night for support, even though he has got his own practice. And very nicely, he has been honored by UNESCO, and he is the president of Indian Medical Association, a very prestigious body of the Maharashtra chapter, and doing wonderful job for. And he has written immense articles, and he has come in various shows. Good that he found little time to come to our show also. And Dr. Avinash, You can.
Yeah. Uh, Thank you, Dr. Sekhar, and good evening, everybody. Uh, Rather, I would like to speak on the basic realities of India, in which rather the India is not going ahead. If we think that India is a country, mostly there is a prominence of villages, and but the most important thing at that literacy level is not good. It is in some states like Kerala, it is good, but many of the states it is not good. And because of that, and along with that, the health literacy in even in the educated people is not at par with the you can compare them with the American people or the European people. So this is the one thing where after COVID we may improve and will have to improve. So health awareness, as for years together, the doctors and everybody is telling rather talking about the simple care like hand washing, like using rather keeping cleanliness, and all these things were told, but they were not followed. Now, at least in a suburban part of the in the city dwelling people, they are always rather thinking about all these this cleanliness and other things, and that will definitely improve. The people were talking about the health as just a thing to be rather afraid of, but now they will be definitely taking care. The most important thing that health is a sector which is always neglected by the government of India for years together. Uh, as Dr. Rajkumar said, we have less number of doctors. We do not have only the less number of doctors as per population, but we have less hospitals, less nursing colleges, less other paramedical workers institutes, teaching institutes. So everywhere we are lacking, and the main reason being that the India is not the taking care to provide a good amount to the health budget. In India for last so many years, our health budget, the central health budget, rather takes only 1.3% to maximum 1.5%, whereas the actual need is 5% or more. If you compare it to the other countries, not only in not only to US or the America or the European countries, but we compare it to the Sri Lanka and Bangladesh, who are very nearer to us and not very rich countries. They have their health budget higher than India as per the GDP percentage is concerned. I'm from Maharashtra, and the government of Maharashtra, the Mumbai, which is supposed to be the capital city, rather the financial capital of India, Maharashtra government provides only 0.5% of GDP. As because of that, it is very this thing, and for years together, we have been rather every time we have been suggesting, we are sending letters, we are talking in the seminars with the government that we have to increase at least for 3%, but it is always ignored. So we have less number of doctors, we have less number of hospitals, the government hospitals. I passed in 1982. I passed MBBS in 1982. At that time, the number of hospitals, the government hospitals in Mumbai and in Pune, they are same. If we compare the number of beds per capita, they are also not increased. They are increased only by 15. They were something around 108 per lakh. Now it is 113. So is a total negligence from the rather they were not giving very much importance to the health sector, and now that question rather now they have realized that this thing we have to consider because when this COVID epidemic started, if you remember, all over India we had only one testing center, that was NIV in Pune. Now we have more than 300 centers all over India. That was the need, and if we provide a good amount, I am sure that after COVID, the government of India will definitely increase its health expenditure and the provision for the health arrangement. So we'll have to increase the number of, see, the hospitals are divided into some categories. For the rural and the distant areas, we have sub-centers and primary health centers. Right now, they do not have any rather any arrangements or any facilities there where a person can get treatment. Even in a rural area, in a village of India, anywhere, if a person gets enteric fever, he has to go to a place at least for 50, 100 kilometers away. Sometimes these primary health centers and sub centers are used mainly for the deliveries. But if there is a difficult labor, they have to go very far. The roads are not good. The ambulances are not there. So all these things will be rather definitely improved. Then the secondary level hospitals, they will have to increase in number as well as the facility. The district hospital, the most important thing, the tertiary hospital. Right now, anybody in India who is a middle class person or the upper middle class person has to take some uh, treatment in a tertiary hospital. He has to go to a private hospital, in a corporate hospital, where the expenses are tremendous. You just cannot compare. So they have to go there. But now after this COVID area, the government hospital, we are expecting to increase the number in the hospitals, the facilities in the hospital, as well as the hospitality in the hospitals, which is rather right now it is lacking. So that is definitely has to increase. Along with that, I told you that the number of nursing colleges, we don't have not only the doctors, but we don't have enough nurses also in India. Also the paramedical, this thing, technicians. If you think about the uh, dialysis machine, we do not get enough technicians for the dialysis machine because there are not enough courses. The universities do not conduct. So that will be also again taken care of. And about the equipments, the all the government hospitals will have to be well equipped with the number of these ICU equipments as well as the higher surgeries like brain surgeries or cancer surgeries or like that, which right now for this people have to depend or rely upon the private or corporate hospital. Uh, After that, secondly, in India, after 1984, I think when the these private sector, rather the health sector was introduced in a corporate sector. After that, the Apollo Hospital was the first corporate hospital in India, and it started all those developments in the cardiac surgery, brain surgery, and all that. Right now, we do not have enough seats or numbers in our government medical colleges because there are not enough number of government medical colleges. Because of that, we are not getting enough number of doctors. So after this, the government definitely think about the government medical colleges. Right now, we have whatever the growth in the medical colleges is only from the private sector. There are lot number of private hospitals or private medical colleges in India, especially in Maharashtra, Karnataka, and even the Tamil Nadu and all over. But the government hospital will the government medical colleges numbers will increase. Along with that, there will be specialty and super specialty seats will definitely be increased. That is very essential for the growing India. That will be the major advantage for this COVID, this thing, that government will definitely increase. Right now we are the government, or even in India, if you look at the Mumbai, there are a lot number of patients, but the hospital beds are not sufficient. There are a lot number of patients, the doctors are not sufficient. Even the private doctors are called, the number is insufficient. So that is the thing which will definitely we have to improve, and I'm sure that it will improve. Then there is one thing that it is always said that the government, the doctors, the private doctors or the doctors are not ready after their passing their uh, MBBS or even postgraduate. They are not ready to work in the government hospitals. There are a lot of government hospitals, but there are no doctors, and the doctors are cursed. But the basic reason is there is no infrastructure, there is no work environment, and all these things will have to improve. There are so many bonds. When a doctor in Maharashtra, a student in Maharashtra passes his MBBS, he has to undergo a bond with the government. And if he does not sign the bond, he has to sign the bond. And if he wants to do post graduation, or he has to go abroad, or do something else, he has to clear that bond with that a big amount of money. But if anybody wishes to work in a government structure, there is there are no places, there are no posts available. And whatever the posts are there, government is not ready to fill up. So that will definitely increase. And that is definitely a change we'll see. And most important thing, which we at Indian Medical Association, we are always rather stressing on the fact that, like we have the IAS for the administration services, we have IFS for the foreign services, we should police IPS, we are the police services. Like that, India should have IMS as the Indian Medical Services, which will give a boost to work with the government, and it will definitely have a very good culture. And that we have been time and again we are proposing, and we are sure that in years to come, this change will occur, and India will get good number of doctors in the government sector, and that is very very important. As far as the about the telemedicine, Dr. Rajkumar told that telemedicine is really a boon to the medical practice. In India, right now, we do not have much facilities in the rural areas and in the very remote areas. There, the doctors are there, but they do not have the treatment facility, or they do not have the specialist there. So, with the help of telemedicine, it will definitely increase. Right now, there are some research institutes have already proposed that in a suppose the this COVID pandemic increases, rather spreads its wings all over India in a very large number, then a time will come where all the small peripheral centers, sub centers, primary health centers will be full with the patient, and the doctors will be there. But what to treat, what to give cannot be, rather they are not very well versed, and that time the telemedicine will be useful. Right now, the government has passed a bill, but but the doctors are not rather allowed to do telemedicine practice. There are a lot of hazards, but definitely government will come to know that that is the thing of the future. And in India, while we are doing all the development, that is also important. About the last 2 points which Dr. Rajkumar said, that the insurance, the Indian people are always saving money uh, on the essential things, and they're spending on the non-essential things. A person will spend few thousand rupees to purchase a television set, but as far as the insurance is compared, he won't go for it. At the same time, the government of India has given a very smart proposition or smart scheme, which is Ayushman Bharat. Ayushman Bharat is nothing but a insurance scheme in which all those lower income group people are insured, and they are paid, and the doctors who treat them, they charge less. So in India, after this, the every person will come to know that, because such type of epidemics are going to come in future also. It is a prediction by WHO few years back, and this is going to happen. And so the insurance, to insure every person, every person should be insured, and as per that, many schemes should come. Right now, the insurance company are just thinking about the profit. I will tell you one thing, that to include the COVID as a treatment, the government had to fight with the insurance companies. Just few days back, it was sanctioned. One more thing, we in Indian Medical Association, as we all know, that the doctors, private doctors are also treating, they are getting infected. So we are trying to have one insurance, indemnity insurance, like insurance. Suppose we get COVID, we'll get that much amount, like accident policy. So one very major company accepted it in the month of March. So few hundred doctors rather enrolled in it, But as the number started increasing in the month of April, they just stopped this thing and withdraw all this thing and refunded everybody's money. So this is the approach. It should rather change. At the same time, the government is now ready to give this term insurance for the private doctors. They are offering the insurance to the press reporters, but not to doctors. So apart from that, the insurance, definitely people will look at insurance as an essential thing, and they will definitely work on it. And about the medical tourism, as Dr. Rajkumar said, a there is a much thing. There are so many things we have to do. It's a very growing sector, but there are so many hospitals are doing this. They are trying for this medical tourism, but it has not grown because of there is no support from the government. Like we want to do Mera India and all these tourism, this thing, we should rather promote this medical tourism outside, and that has to occur. That will definitely give a boost to the Indian economy, because in rich countries, it was discussed that in UK, because of the national health scheme, a person if he has to go undergo a cardiac surgery, he has to wait for some time, and at the same time he can come to India, get all his surgeries done at a very nominal cost as per their cost structure, and can go back. So doctors are good here. Doctors are very dedicated. The treatment is good. The facilities are good. Only the number is not good, and there is no government support. So all these things are definitely going to change post COVID. So there are so many things to talk, but these are the things I would like to stress. Thank you very much.
Thank you.
Doc, can I just quickly
Please.
add a couple of things? Dr.
Yeah.
Avinash, if you ever stand as president for the whole IMA, for the whole country, which I think you should, you have my vote. Lot of very,
Okay.
not only my vote, I
Yeah.
shall canvass for you also down south.
No, no,
So
no.
can I
We,
just,
MA,
I said,
MA should be proud to have him as the
president, yes.
and,
It's
and,
good.
and he's doing full justice, and I
thank you.
think it's
Paka.
an enlightening way. He has taken us through a whole gamut of policies, programs, and the solutions. Because only not only one thing is it's always nice to say problems. You have to give solution.
Yeah. Thank you.
My next man is somebody who is a combination of problem solution. He has been one of the highest, very successful additional commissioner in Navi Mumbai Municipal Corporation. Also in charge of COVID for Navi Mumbai. He has got trained, educated in all parts of the world. Mm. Now he's associated with Government of India more like an auditor for many of the programs, and also he's with Tata Trust for many of the expansion plans. A very versatile, pleasant man, Dr. Sanjay. Please, your thoughts, please. Sanjay said he's going to be short, so but still, I would like him to say whatever. He has got the real life experience, and he has even been in Manipur, this place, that place, so many places he keeps going for seeing the medical. He gives his life for the medical field. He also, like Rajkumar, his wife is also a medical doctor, so they are similar patterns. Dr. Sanjay Pattiwar.
Yeah, thank you, Dr. Shekhar. Thank you, Dr. Avinash. Thank you, Dr. Rajkumar. And thank you, Mr. Akram. I'm basically a public health man. Uh, I think whatever Dr. Bhondwe sir has told about the government apathy and these things, I work in government for 33 years. But after working for 33 years, I think I have to agree with the Bhondwe sir, because that is the real situation. Because I was in government service, so I was not able to talk about that. But now I'm a retired person, so I have a free bird and I can tell everything about that. So, basic thing about COVID, Dr. Rajkumar, the basic problem in India is that there are 10-star facilities are there, but 0-star facilities are not there. There are minus facilities are there. There is a lot of difference of class is there, difference of services is there, quality is there, everything is there, and government is not in a position to tackle, or government doesn't have the mindset of pouring the money and increasing the infrastructure. That is a great problem in India. Considering the COVID situation, and I'm a public health man because I have worked in primary health care, there is a difference of opinion, or we have to make a difference between the primary health care and the hospital care. So both has to be very strong. But what is happening? The government is only planning, designing, but no implementation at all. That is the basic problem, because the Mr. Shekhar has given us the entire list of human resources, but still they are very less for us. And there are different type of pathies are there, different type of personalities are there. Even we have the bogus doctors. Why not to utilize these bogus doctors in a good way? So there are a lot of things are there. I think the post COVID is should change the hospital setup, should change the primary health setup. Government should come heavily in the primary health care. Government should think of PPP model or new normal thing or new technology, or to have the association with NGOs, association with private entrepreneurs. So I think government will not be able to give these type of services even after post COVID. Whatever the decision was regarding pouring 20 lakh crores of in the economy, I don't see anything in for the health or primary health or hospital purpose. It is very difficult to find out, even in the pandemic era, in the COVID era. I think still government is not able to pinpoint. So that's why the problem, basically, we thought after post COVID or in post COVID or before post COVID, it was a necessity to have a primary health care, because pandemics are not a hospital problem. Pandemic is a primary health care problem. It is a problem of people. It is not the problem of any medical faculty or anything. Once we have a good primary health care, we will definitely would have controlled this pandemic or this COVID, because this is basically the disease. What we are doing, we are talking about the hospital treatment. Nobody is talking about the prevention, promotive, and the early diagnosis and the prompt treatment. These are four things which are very important. I think the people are also very frightened about that. People are also there are Dr. Avinash sir told that there are health education is there, not at all there in educated people. Where I'm staying in my building, one, I should not tell him, but one IIT IIM person, he has not come out of the his house from last 3 months. So these sort of things are happening in India. So there is a need of health education, health awareness, standardization of services, then the quality of services, then the increasing staff in primary healthcare. There has to be. I have worked in urban areas as well as rural area. There are no standard operating protocols anywhere. The government should come with the standard operating protocols. The in Western countries, I think I should not blame the Western people, or I should not praise the Indian people. But the Western people, they are going according to the standard operating protocols. That's why they are not missing any point. In spite of the Indian doctors are very clever, they have seen thousands of clinical patients. Still, they are missing some points because the standard operating protocols are there. Again, the problem of infrastructure is there. So I think after the post COVID, there has to be government directives has to come. Otherwise, the people or the private sector will not be able to tackle the situation in future. And again, they have to strengthen the primary health care approach, the public health approach, and they should think of developing infrastructure. The now the rural area is sufficiently managed through the public health workers, but the urban slums are very dangerous. We have seen the point of Dharavi, we have seen the Koliwada, we have seen the lot of people urban slums where the health indicators are lower than the rural areas. And why this is happening? Because there is no planning with the government, and the speed of development of all these. We were thinking of that the urban cities are going to be the growth centers, but what you have seen, the laborers have migrated, all people have gone. There is a lot of fear with the urban areas. So again, decentralization has to happen. So previously we were thinking that urban cities are going to be growth engines, but I think Dr. Shekhar sir also, I don't know his views about the urban cities, whether they are to be continued as urban growth center, or we should decentralize throughout the area. So we have seen the impacts of both the type of things. This is the urbanization, then ruralization, the migration, all these things are there. So I think after post COVID, we have to have new normal. We have to have technology which will reduce the prices, and whatever the health facilities are there, it has to be affordable, acceptable, available, and good quality. So and after post COVID, there are going to be increase in the cost of the medicine, cost of the services, and the people are going to be very afraid of small things. So it is going to increase the burden on the health facilities, hospital facilities. And we know about the lockdown has given us only space to prepare for the COVID patients. It is not containment has happened, but after unlockdown, it's going to create a problem. Again, we have to have the public hygiene, personal hygiene, social hygiene, because this pandemic, this COVID has an impact socially, economically, pandemic, global, and on the medical faculty and the public health faculty, and the individuals, and in the public, on the industry. So this pandemic need to be the medical fraternity has to. Dr. Avinash is a powerful man of IMA, and he's our president. But I know he is also fighting a lot of things, but still the government is not awakening. He is continuously writing to the government, but still there are a lot of things need to be planned, need to be introduced, and I think this is the time that I don't know which type of IOG is going to be in India, which will give a guidelines. You know, the Medical Council of India has been thrown out. There is some new the board has come, but we doctors don't know exactly. And the last point I will tell you, the decisions are being taken by the non-technical people and implemented by the technical people. So in India, the decision has to be taken by the technical people, and it should be implemented by the administrative people. That has to be there. But you know, the in COVID situation, in pandemic situation, what has happened? It is I think the epidemiologists, the public health specialists, and the clinicians should have come together, and they should have given some advice to the government. But the bureaucrats are giving the advice. Though, so it is not epidemiology; it is administratology. So I think there is a need of looking Dr. Rajkumar and Dr. Avinash. Avinash sir, I know him personally, but he might not be knowing me. But after this webinar, I will again connect with him. I will give a lot of things to him to fight and to improve the medical and public health facility in India, in Maharashtra, and that is the need of our. Thank you. Thank you so
Thank you.
much.
Thank you.
I just quickly say something after
Yeah.
his talk. I know now somebody asked Moraji Desai, is India a forward country or backward country? After listening to Dr. Avinash and Dr. Sanjay, you will understand his answer when he said India is not a forward country, not a backward country, it's an awkward country.
Like that,
Because there
I
are
will add to you. I will
lot of
add.
problems are there. I'm telling you, India
Yeah.
is deviating to the insurance side, and you know the what has happened in UK, USA. Our policy was good, I think, but still we should not go 100% on the insurance side. We should not go 100% on the private side. We should have a balance between insurance, private hospitals, and the public health care. That is, we have to have three type of healthcare facilities like UK, like US, and original Indian. So these three combinations will definitely improve the health of Indian people.
Yeah, I agree with you, Dr. Sanjay, that you said that the administrators are ruling all these uh, epidemic, and they are giving all the advices and all the rulings. Uh, a day before, I was asked that in next 2 days, uh, we will be completing 5 months of this COVID pandemic in India. So, what is your impression? So my answer was a big confusion. The only word was a confusion. Why confusion? The government is confused. What is that? When it will be over? Then the doctors are confused. What to do today? What will be the rule next day? What will be the legal ruling next day? And the common people are always confused that what is this and what is going to happen? Whether I am going to be alive or something will happen to me. So it's a big confusion. Thank you.
So it has been a very interesting session, but there are a few points which I have to bring it on a three, four multiple. One is COVID, as we know, is something what we call as a world war. Okay. This is a World War Three. World War Three fought not by the Javans. Javans are supporting in a different way, but by the medical practitioners, medical professionals, and whatever is the healthcare systems. Now, in this war, we will have a lot of things to learn. We will have few things to change and few things to very effectively change. One of the big points brought by our friends here was that what about our systems? Okay. Our systems would need a lot of money. As you all know, I am working on a doctrine called secure governance. And I am saying how the money will come from the system. Because there's no money with the government. Government is not having the money and not giving. But maybe they can do some partially here. They can just drop from education and give it here, and drop from something else and give it somewhere. Because what we need is very large money. So in secure governance, many people ask me, how will you do in health? How would you change the health system? My way in which few people have already started practicing is, now many of the health infrastructure has what we call as an FSI of 5 to 6 to 7 also. It is a subclause which says that some portion of it can be commercialized. What I'm telling these people is, when you have something like this, you commercialize 50%, but have a Chinese wall between the two, which means there should be no combination. Use that permanently to feed the health portion. So that and make many of the government departments to come inside this. This I'm telling even for education, because these two have to be funded. No education can fund for itself. No, this tourism and all will bring money. I always say tourism should be with the finance department. That's only money earning department. They should never spend one this thing on tourism. Okay. Whereas health, you cannot say that it should be funded, except in the Robin Hood principle, some rich person may come and he is ready to pay a big amount, or just medical tourism people. But what we require is far, far, far more than what medical tourism or for the 0.5% of rich people what they can pay. So we need to have a permanent structure in which things have to work. So my philosophy is that let every medical institution do some portion. This IMA can do. I can give a note for you that permanently there you put X amount where you encourage government departments to come so that you have permanent revenue, and that revenue should go to fund. Then the cycle comes. And whatever government does, yes, you should fight for it. For that, I'm not saying you should not fight for it. But they can do minuscule. In the 1.5 for them to go to 1.5 to 1.75 will take some time because they got their own compulsion, which I and you cannot sit, but they are sitting in the chair of this thing. Of course, other suggestion which Dr. Bhosle, Dr. Avinash said that we should have a separate IAS, IPS type for medical. That will be an excellent position because after all, the position means something. Because then you are officially respected. Your words are taken for this. So that is one thing which will have a very good effect on the system in whatever I'm saying as a self-sustained. Because unless we make health a self-sustained system, it will not work because our problems are very very different from other countries problem. Other countries do not have the number of people, the population, the type of problem, the type of complexity of problem, the type of, some, as I said in the beginning, some type of solution which we have, which even the medical practitioners cannot give. We have a complex system. After all, we are such big believers also. We are such believe we are such great runners also. At the same time, we have a combination of people, history. No country is as this thing as we are. The number of languages, the number of this thing. We are the only country which can have blackest of the black, whitest of the white, tallest of the tall, shortest of short. And so we cannot. And health is something which is there for everybody. But Indians are so this thing that we are even very very bothered about our own animals around us. We like it that way. So health has to have the self-sustained entity that we should do, and this particular COVID system has to bring the change. Otherwise, COVID has really devastated our economy. It's something which, like he said, I'm just waiting for something to start happening because I was working on a $5 trillion and $10 trillion and all. Now I do not know whether $0.5 trillion will come in the economy. That also, of course, in a different way, I'm making it happen. But medical and health has to have its own core role. And since the time is exactly at 6, let me thank all of us that we have maintained our time because I always
Uh, just I'll add one thing, sir,
please.
about the money.
Mm.
We had suggested previously that, like Swachhata says 0.25% on transaction, you can have health cess.
Absolutely,
Okay.
absolutely.
Yeah, 0.25, point 0.5. It will have a good amount of money which can be taken.
Very
There are
true.
so many things.
Transaction tax type something has been put on health because health is basic for everybody. There's
Yeah,
no question of it is not
yes,
any
sir.
gratis going to somebody.
Yeah,
Another portion is where it will be self-sustained. Once something is put, my question of the FSA and all will bring in permanent revenues. So one will always be
very true.
not cashed out. Thank you so much, and
Thank you.
then maybe we will
Yeah, thank you.
conclude
We
this.
should do this again. Thank you all very, very much.
Thank
Dr.
you.
Avinash, Dr.
Yeah,
Sanjay, and
yeah,
Dr. Shekhar for brilliantly chairing it.
yeah.
It's been such a pleasure to listen to the others and participate over the last 1 hour.
Thank
We
you,
should
sir.
do this again.
Yeah.
Yeah,
Yes.
sure. Why not?
डॉक्टर अविनाश बोलतो मी तुमच्याशी नंतर. Yeah.
Okay.
Thank you.
Thank you all very much.
Thank you.
Wonderful discussion with experts. So much of positivity. At the same time, I found some sarcasm in between.
Here's health.
So confusion